So what happens when politics meets healthcare? Imagine hundreds of doctors who have been helping to run hospitals and clinics suddenly being caught in the middle of an international pressure. Well, that's exactly what happening right now in Jamaica, after the government announced it will end its long-standing medical cooperation agreement with Cuba. 50 years, by the way. But the big question people are asking is this: is this really about healthcare or geopolitics? Let's talk about it. So for decades, Jamaica and Cuba has shared a medical cooperation program that brought hundreds of Cuban doctors, nurses, and medical specialists to work in Jamaica's public health system. This relationship dates all the way back to the 1970s. At one point, more than 400 Cuban medical professionals were working across Jamaica, helping to fill critical shortages in hospitals and clinics. Many of them served in rural communities where doctors were desperately needed. But now, the Jamaican government say that agreement will come to an end. Officials say the two countries simply couldn't agree on terms for a new deal after previous agreement expired. However, the timing of this decision is raising eyebrows across the Caribbean. Why? Because the United States has recently been putting pressure on countries to end Cuba's overseas medical programs. The US government claims these missions are a form of forced labor, arguing that Cuban doctors are not paid directly the full amount that host countries paid for their services. But supporters of the programs tell a different story. They say Cuba's medical missions have helped millions of people worldwide and receive health care, especially in developing nations that struggle with doctor shortages. And I, growing up in Jamaica, can remember that we always talk about how good the Cuban doctors have been in the country. From as I said earlier, from the rural areas to when we have any disasters, and they always send the doctors over to help us. But this is just crazy. So let's now reason about this for a moment, by the way. For many Caribbean countries, Cuban doctors have been a lifeline. In a small island state where there simply ain't enough local doctors, these medical missions have helped keep hospital functioning. So the question becomes, if the programs ends completely, who will fill that gap? Training a doctor takes years. Recruiting foreign doctors is expensive, and many Caribbean healthcare systems are already under pressure. So while the political debate continues, ordinary people are wondering about something much simpler. Will there be enough doctors in the hospitals? Let's look at this under wider context though. Cuba is known globally for sending doctors abroad as part of what many call medical diplomacy. Today, tens of thousands of Cuban medical professionals work in dozens of countries across Latin America, Africa, and the Caribbean. So for Cuba, it's both humanitarian support and an important source of income. For countries like Jamaica, it has been a partnership that helped fill critical healthcare gaps. But in geopolitical tensions increasing, programs like these are now being viewed through a different political lens. The Jamaican government say Cuban doctors may still be able to work in the country individually under Jamaican labor laws, but the decades-long government-to-government program appears to be coming to an end, and that raises a deeper question for the Caribbean. Should healthcare partnership be shaped by political unrest or global politics, or simply by the needs of the people? Let me know your thoughts in the comment below. Do you think Jamaica should keep the Cuban medical program, or is it time for a different approach?